3 to 5% of all school-age children are diagnosed with ADD/ADHD. Many psychological disorders mimic ADD, such as anxiety disorder, depression, bipolar disorder, sleep apnea, and many others. ADHD is the inability to focus, being overactive, not being able to control behavior, or a combination of these core characteristics. The core characteristics of ADD have been recorded in medical documents since the late 1800s. It wasn't until late 1990 when the first brain mapping and imaging studies showed evidence that ADD/ADHD is real in the way the brain functions compared to the norm. Brain injury, genetics, and other medical and environmental conditions are what causes ADHD. Areas of the brain work too hard and other areas don't work hard enough, and that's where the core characteristics stem from. Psych studies are the source of current research that is leading the pack in ADHD breakthrough. These studies show different areas of the brain activated during concentration. It shows deficiency or excess of certain chemicals in the brain and how the brain responds to this. There are 6 subtypes of ADHD: classic, inattentive, overfocused, temporal lobe, limbic, and ring of fire. In each subtype, a different part of the brain is affected. I personally have ring of fire ADHD. On a 3D active scan, the blue areas show normal activity and the red areas show increased activity. Ring of fire gets its name because looking down on the brain, you see a red ring. This means that too much brain activity is happening across the whole cerebral cortex as opposed to one specific area of the brain. Ring of fire possesses combined characteristics from each of the other subtype groups with an increase in aggressive behavior, rigid thinking, fast talking, and hypersensitivity through senses. Each of the subtypes contain different recommended medications, herbal treatments, and diet. However, the preceding topics in this presentation are being seen through a classic ADHD lens. Classic ADHD involves a decreased activity in the underside of the lateral prefrontal cortex. The symptoms of this include distractibility.
ADHD comorbidity. Comorbidity is the simultaneous presence of 2 chronic diseases or conditions in a patient. ADHD comorbidity would be having attention deficit hyperactivity disorder paired along with another chronic disease or condition. What we can take away is that when studying patients with comorbid conditions, it is important to assess the condition separately, and that some abnormalities related to different diseases could be the result of ADHD and vice versa. This is seen in the article, ADHD comorbidity can matter when assessing cortical thickness abnormalities in patients with bipolar disorder. Assessing cortical thickness just means the gray matter around the brain. The study included 85 subjects, 31 healthy controls, 17 with only bipolar disorder, 19 with only ADHD, and 18 with both bipolar disorder and ADHD. Significance maps were used to check for both main effects of bipolar disorder and ADHD and their interaction. Post-hoc comparisons assessed how the effects of bipolar disorder on cortical thickness varied as a function of the presence or absence of ADHD. This is a figure that shows bipolar disorder versus non-bipolar disorder, ADHD versus non-ADHD, bipolar disorder only versus controls, and comorbid versus ADHD only. These are the different hemispheres of the brain, how they look different compared to one another. In the article, we find out that there are overlapping symptoms between bipolar disorder and ADHD, and there are differences. And oftentimes, differences that are the result of ADHD are attributed to bipolar disorder, which is why they should be assessed separately and not as one. In the article, Attention Deficit Hyperactivity Disorder in Cocaine-Dependent Adults, a Psychiatric Comorbidity Analysis. The method is a total of 200 cocaine-dependent patients attending an outpatient drug clinic participating in the study. A systematic evaluation of ADHD and severity of addiction. A descriptive bivariate and multivariate analysis of the data was performed. A total of 249 subjects on current treatment were invited to participate in the study. Of these, 200 completed the required evaluation process. ADHD was more common in males compared to females, and the difference was statistically significant. However, in the general population, there are more males than females with ADHD. With regard to comorbidity with Axis 1, patients with ADHD experience depressive disorders more frequently during their lifetimes, while no significant differences were detected for anxiety disorders. With regards to results relating to addiction severity, poor functioning was seen for ADHD patients in the occupational, alcohol consumption, and psychological areas or domains. The greatest occupational difficulties may be expected in patients with ADHD because symptoms and changes in executive functions usually affect performance at work. The higher alcohol consumption score suggests that subjects with ADHD drink alcohol more often at the start of treatment, perceive such consumption as more problematic, although they do not have higher alcohol dependence rates.
ADHD is generally understood as a children's disorder, a child's difficulty paying attention in school or maybe being too hyperactive. But the truth is that adults deal with ADHD as well. If ADHD were only a children's disorder, then the symptoms of ADHD would lessen drastically over a child's adolescence. But studies have shown that this has not been the case. Since ADHD is known to be a developmental dysfunction of the brain, we cannot expect it to just go away or expect a child to grow out of it. Because ADHD is most commonly diagnosed in children and adolescents, the study of adults with ADHD has been neglected. The general idea that a child can grow out of their ADHD comes from the noted decrease in ADHD-like symptoms as patients reach adulthood. Dr. Newton Howes of London calls this decrease in symptoms not getting over your ADHD, but the acquisition of cognitive strategies to ameliorate these features. This means that an adult or adolescent with ADHD may learn to cope with some of the symptoms, but studies show that a large amount will still live with one major disabling symptom. Once we understand that ADHD persists past childhood, we have to understand the ramifications for adults living with ADHD and how it affects their lives. The main symptoms of ADHD, inattention, impulsivity, and hyperactivity, are all features of childhood and adult ADHD. But hyperactivity is more often seen in children. These symptoms create difficulty and poor concentration in the workplace, inattention to tasks, quick temper, and an extreme impatience. Dr. Newton Howes also notes that these symptoms also can lead to difficulty in relationships, creating a satisfactory work environment, and a difficulty in general life enjoyment. 70 to 75% of adults with ADHD also have at least one comorbid diagnosis. This can lead to difficulty in diagnosing ADHD if the symptoms of the comorbid diagnosis are overpowering the symptoms of ADHD. It is important to diagnose both for the best possible treatment of the patient. Dr. Newton Howes concludes his article by stating ADHD is a disorder whose features change over time, but which commonly persists into adult life. For adults with ADHD, the future is much brighter than it was even 10 years ago. Because the idea of an adult diagnosis of ADHD is becoming more popular, treatment options will hopefully become more widely available.
Wake up, Prof. Allen, and welcome to ADD ADHD News Channel 3.14.
Did you know 3.14 was pie?
Pie? I like pie.
I love pie.
She loves pie. One-upping me all the time. Okay, wait. Focus. Let's get back down to it. For our first report tonight, we'd like to touch on ADD ADHD in schools and the effects of testing times. Now, turning it over to our lead anchor, Morgan Durr. Morgan?
Thanks, Ellery. Children with an extended time for testing has always been a controversial subject. In the study of extended time accommodation for ADHD, it was found that even though students completed more problems in the longer amount of time, they found that the normal amount of time when students completed the same exact work was with more accuracy. This also did not differ based on medication, if they were on an IEP or a 504 plan. It was pretty steady across the board. As time went on in both studies, in the extended time and the shorter time, it was found that both times were completely the same in the fact that they did not did not lose focus like I'm doing at this point. Lose focus.
Forget to take your medication this morning.
I don't talk about it. Okay, my dog ate my pills. Sorry.
All right, let's focus.
Okay, sorry. What was I saying? Oh, I was talking about. Got it. They were. What was I talking about? Extended time.
Extended time.
Okay.
Yes.
Yeah, I got it. Okay. They lost focus at the ends of both segments, so the long one and the short one, that was unanimous across the board. There were a couple limitations.
Limitations?
Yeah, to the study. It was a pretty significant one. They did this study while they were at a summer camp for ADH students.
Summer camp?
Yeah. And a lot of these students weren't used to being in a normal class setting, which led to the difficulty of generalizing this study.
Very interesting.
Yeah. They even went to say that if you're going to give ADHD students extended time, it should be depending on the goal of your outcome. Sometimes it is better to have a longer period of time for someone to complete it, but to pull a kid out of class during instructional time to go over a test means that they'll lose that instructional time where they could have been listening to the teacher and learning things. Also, they may benefit from having education plans, like I said, the 504 plan and the IEP, based on their needs. It really does not matter the amount of time. There's not much difference between the extended time and the normal time. In a normal classroom setting, they should use the normal time unless a special project.
Interesting.
Yeah.
Interesting.
Yeah. That's all I have. But I'm turning it back to you, Ellery.
Thank you. For our second report, we are going over medication.
Oh, did you see the squirrel?
It's like Spider-Man.
Right.
Oh,
Whoa, what
back down to
just
business.
happened?
What are we doing?
What are we doing?
Jeez. Okay.
Back to you, Ellery.
Back to me.
All you.
So, medicating ADD and ADHD. Well, we have been medicating ADD and ADHD for 30 years.
Wow, that's a long time.
Yeah.
Longer than I've been born.
Very long time. Very long time. Just kidding. I'm kidding. It's not 30 years, it's 50.
That's even longer. And
Yep. It's awkward. 50.
that's my dad's age. Almost.
Cool. Anyway, but in 1937, the use of stimulant medication began. But shockingly, it was not used on a grand scale until 1957, when Ritalin was introduced. Come back to us, Morgan.
Listen to the jingling.
Come back to us, Morgan.
I'm sorry.
Okay.
Yep.
But there are three primary stimulants used when medicating. You can have methylphenidate, which is Ritalin, dextrostat, also known as dextidine. I'm not a doctor. I'm an anchor. And then you can have Premaline, also known as
Cyst? Cyst.
no, not a cyst. Woo!
Are you sure? I'm pretty sure that's how it's spelled.
Nope, it's like slurt.
Okay, slurp. Like slurp.
Sure.
Okay.
Then, for another use of stimulants is the use of Adderall to treat ADHD.
I love Adderall.
Focus. Anyway, stimulants are known to be 70% effective, and they help children remain in the norm of work ethic
Mm.
of others. Yep.
I read about that in mine too.
Oh yeah. They also help reduce restlessness,
Which would help my ADHD students.
yes, it would very much.
Yeah.
Maybe yourself. Anyway, stimulants also help improve the control of emotions. Yeah. They enhance the accuracy of work and the ability to plan tasks. Medication helps improve the child's or person's level of functioning. And it allows the child to acquire better skills for the future. Yeah.
That's really good.
Uh-huh. But it's not a magical pill. Nope. You don't gain skills from taking them.
Really?
Nope.
Wow.
Nothing. But with stimulants come great concern.
That's deep.
Yep, I know. So, part of the concern would be the stunting of growth. Yeah.
So that means I could be a midget for the rest of my life?
No, too far.
Oh.
That escalated really quickly.
Okay.
Real quickly.
Okay. My bad.
But kids that haven't hit puberty yet, there have been studies to see if it actually stunts their growth. Yeah, but it's proved wrong.
Oh, that's good.
Yep.
Good.
But it is suggested that even kids with ADD and ADHD, they actually they have a shorter pubertal. It's a big word.
Cycle?
No, it's like, yeah, no. They have slow growth when it comes to like puberty.
Oh, okay. I gotcha.
Yeah.
We're on the
Medical
same level.
terms.
Gotcha.
It's a good thing we're not doctors.
Right?
Yeah.
Except you might be a nurse, but...
No, I'm an anchor woman.
Oh, anchor. Forgot.
So besides those concerns of like growth stunting, there's also appetite suppressants, and yeah, the common side effects of the main three are insomnia, decreased appetite, weight loss, headache, irritability, stomachache, and nausea. Yeah, sounds pretty tricky. Yeah. So there are other side effects that include socially withdrawn, over-focused, and emotionally upset. But those can occur right after you start medication. And that can be a sign of either over-medicating, like having too high of a dose, and sometimes it can be a sign of not medicating enough.
Wow.
Yep. And did you know that Tourette's syndrome can actually be brought on, too?
Wow.
Yes. Like, when kids start being medicated, it can have an effect of Tourette's.
Yeah.
It's fairly common between the ages of 6 and 12 years old.
Wow.
Your mind is blown.
I am. It's like I have nothing in my brain anymore.
Yep. I know. It's
Crazy.
interesting.
Yeah.
Aren't you glad that we work for ADD, ADHD?
Yeah.
3.0?
Yeah. Oh, breaking news. I think it's time for JT.
Nope. Not quite.
Not quite.
No. You're breaking news and it's so breaking. Oh, maybe you should get your stuff together. Get it together.
Yeah, probably.
Yeah. Okay. So, along with the side effects and the types of medications, there's actually, man,
Wow.
speech class did not work for me too well. There's also the decision to medicate. Yep. And did you know that sometimes people just don't want to put their children on stimulants? Are you okay? Yeah, some just don't. So overall, it's the parents' decision to medicate, but it's should be
Parents are important.
parents and physicians. That's how they get the medication. I don't know.
You just write prescriptions yourself.
No.
Bad
But
idea?
it should be, the decision to medicate should be based on academic and social life factors. And, help me. Factors to medicate should also be included of the severity of the ADD-ADHD symptoms. In closing tonight, we have a story of survival.
Yep, that's right, our boy JT.
With ADD, it's a riveting story about a boy overcoming the adversity in school with his ADD. Stay tuned.
Grab your tissues.